I would start by emphasising that we are well placed and in a vastly different position to previously. As of today, we now have a vaccination rate which has seen 39 million vaccinations delivered in Australia. We are at 92.2% first vaccination and 86.6% second vaccination, and we've now passed 400,000 boosters. So we are one of the most highly vaccinated societies in the world, one of the most recently vaccinated societies in the world, and one of the best prepared in terms of our hospital system and our public health measures. Nevertheless, on the basis of medical advice provided by the Chief Medical Officer of Australia, Professor Paul Kelly, the Australian government will be implementing additional precautionary border security measures in order to protect Australians whilst more is learnt about the nature and impact of the Omicron variant of concern. So these actions are taken on the basis of cautious prevention. We're in a strong position, but we know that acting early is what has protected Australia throughout the pandemic. And so we'll be taking the following 5 actions immediately, and we'll reserve the right to either strengthen or reduce or remove them as is required. First, effective immediately, anyone who is not a citizen of Australia or their dependents and who has been in African countries where the Omicron variant has been detected and spread within the past 14 days will not be able to enter Australia. These countries are South Africa, Namibia, Zimbabwe, Botswana, Lesotho, Eswatini, the Seychelles, Malawi, and Mozambique. Second, Australian citizens and residents and their dependents arriving from these countries will need to go into immediate supervised quarantine for 14 days as subject to the jurisdictional requirements of the relevant states or territories. Third, these restrictions also apply to people, for instance, such as international students and skilled migrants arriving from our travel bubbles who have been in any of the 9 countries within the past 14 days. Fourth, anyone who has already arrived in Australia and who has been in any of the 9 countries within the past 14 days must immediately isolate themselves and be tested for COVID-19 and follow jurisdictional quarantine requirements, which will require quarantine for 14 days from the time of their departure from the relevant African countries. And fifth, the Australian government will suspend all flights from the 9 Southern African countries for a period of 14 days as a matter of precaution. There are currently no known cases of the Omicron variant in Australia, and I would just note that there are 20 people in quarantine in Howard Springs in the Northern Territory who've arrived from South Africa in the last week. I've consulted with Natasha Files, the Health Minister of the NT, this morning. They have all been tested, 19 negative, 1 positive. The nature of that positive will be considered, and I understand the Northern Territory is saying more today, but at this stage there are no known cases of the Omicron variant in Australia. We've taken precautious action in the past. We've taken early action in the past. We are doing that again, and the difference is that we now have strong vaccines. We have one of the highest level of coverage in the world. We have one of the most recently vaccinated populations in the world, and we have strong public health and social measures, and we also have most significantly a well-prepared hospital system. I'll invite Professor Kelly to speak.